Managing the elimination needs of the patient.
Let us learn the procedure for waste elimination.
The undigested food is excreted or removed from the body as feces. These wastes are eliminated from the rectum. The toxic wastes such as urea or ammonia are excreted by the kidneys as urine from the urinary bladder. The removal of waste from the body is an involuntary function and it cannot be controlled by the patient. In some medical conditions, the patient is unaware when the wastes are removed from the body. Removal of feces is called defecation and removal of urine is called urination. The wastes are excreted in the toilet when the patient feels the urge or the need to pass the wastes. In patients who can walk, they can express the need and with your assistance can walk to the toilet. However, in many cases where the patient is unable to move, you must support the patient by facilitating the passage of the waste safely within the bed. If the wastes passed from a patient are accumulated and are not cleaned from time to time, it can lead to a variety of infections to both the patients and the people around them. You must not only help the patient in safely eliminating the waste from their body, but also ensure that the surroundings are kept clean. Equipment used for managing elimination needs. Most patients who are in a good medical condition can express the need to use the toilet and manage their needs themselves. However, many of them might need some help to move to the toilet. For patients who are confined to the bed, different types of equipment can be used to manage the elimination needs of patients. Some of the equipment used are: a bedpan is used for patients who cannot get out of bed easily, but are able to express their need to pass urine or defecate. The bedpan is placed underneath the patient who can urinate or defecate as needed. Urinal. A urinal is much like a bedpan, but is meant only for a male. The urinal is shaped in a way that only a male patient may use it while still on bed and remain comfortable. Diapers are used for patients who are confined to the bed and are unable to express or control the need of elimination. These are tube-like equipment that is inserted directly into the urinary bladder and used to empty the urine directly from the bladder. Based on the condition of the patient, the doctor would suggest the usage of the appropriate equipment. You must know the equipment to be used depending on the medical condition of the patient. Placing the bedpan for use. In order to help a patient with the bedpan, you must put the following items within easy reach of the patient: a bedpan, a basin with warm water, disposable gloves, and washcloths. Explain to the person that you are going to help him use the bedpan. This can ease any fear or uncertainty he may have. Lower the head of the bed to the lowest position tolerated by the patient. Make the bed as flat as possible so that it is easier to roll the person to his or her side. Put on the disposable gloves. Ask the person which side he or she is more comfortable rolling to. Ask the patient to grab the bed rails, if available, to stay onto the side they rolled. Bring the patient a warm bedpan inserted in a paper cover, rinsed in hot water and dried. Place the bedpan against the buttocks, ensuring that the curved edge of the bedpan is under the buttocks. This will be the part of the bedpan that looks lower in size than the other. Ask the patient to roll back, ensuring that the bedpan stays in place. Keep your hand on the bedpan until the patient is almost completely rolled back over. Elevate the person's head slightly. Elevate the person's head on the bed slightly into more of a sitting position. This may make it easier for him to relieve himself. Give the patient privacy. Make sure he has a call light button or other means of contacting you when finished. Answer his signal promptly. Bring a basin of warm water. Remove the bedpan after use. There is a procedure for the proper removal of the bedpan. We will learn the details in the following screen. Removal of bedpan after use. Lower the head of the bed to a flat position if possible. Ask the person to roll over so that you can remove the bedpan. Grab the bedpan with one hand and carefully remove it from the person's buttocks. Place the bedpan on a chair and place a towel over the contents of the bedpan. Never place the bedpan on a side table or a bed table. Use a washcloth and towel to cleanse the person's buttocks. If the person has had a bowel movement, use a washcloth and towel to clean the area using the appropriate cleansing methods. If necessary, wash the anal area with soap and warm water. Dry thoroughly. Adjust the position of the patient. Adjust the position and dressing of the patient. Keep the bedding in order. Open the windows to keep the air fresh and clean. Elimination of waste such as feces and urine can lead to different types of infections. You must maintain hygiene while helping the patient in managing their elimination needs. Precautions to be taken while using bedpan. Bedpans are made up of metal, hard plastic or glass in some cases. Respond to the call of the patient quickly. Explain the process politely before placing the bedpan. Always wear gloves while helping the patient use the bedpan. If the patient complains of pain while urinating, or if you observe any abnormality such as bleeding while passing urine or blood in the fecal matter, report it to the nurse or the doctor immediately. Once the bedpan is removed and cleaned, fill it with warm soap water. Use a toilet brush to clean the pan thoroughly. After cleaning the bedpan, sanitize it immediately.